So we were talking a lot about dysphagia before, and I'm going to give a shout out to Chol because I'm going to use I'm going to use that dove in this thing. So this is dysphagia in the same, in the same cohort. So again, my collaborators and co-authors disclosures. So dysphagia, we talked a lot about today, is common complication. It can be associated with adverse outcomes, and being able to predict this preoperatively would be beneficial, so that we can then be able to, use steroids in particular patients, or if we were to do something different, different kind of plate or whatnot, then we would be able to perhaps identify who are at risk and do something differently. So again, machine learning and logistic regression, there's differences. And so we use the same kind of framework. Now, for this study, we used the AutoPrognosis, which is kind of a combination. We were able to get all the various machine learning models, and the computer is able to just kind of put them all together. So it's a novel framework, and it uses this novel algorithm to be able to fine tune each one of those machine learning algorithms and bring a combined result. And we've actually published on this, where this AutoPrognosis has been shown to be able to predict complications with total hip arthroplasty, but in other fields, diabetic patients, cystic fibrosis patients as well. And so this is that pipeline in which all the patient data is fed into the computer, and it's able to then look at all the variables and then be able to put them all together for some sort of risk prediction. So we wanted to build this ensemble model and then predict it for dysphagia, and then again, compare the performance with logistic regression and see which features are important and compare and contrast. So the same population, we just applied it to dysphagia, and we used your Dove questionnaire, and that the residents found that they thought, oh, this would be easy to be able to administer to patients postoperatively. So shout out there. And had a 2-year follow-up from that. We did a chart review, again, the same variables and features, and we built the ensemble as well as the logistic regression and all the other machine learning models. And again, we calculated discrimination and calibration of the various models. So the same population of 1,024 patients, and we had a 6.1% dysphagia rate. This is a mix of both anterior and posterior, so it's not just anterior alone. So there's it's a heterogeneous group here, and we found that the AutoPrognosis performed quite well. It was the best performing as compared to the logistic regression for sure, as well as the other models. Then we were able to find that the area under the curve as well as the Brier score were the best here. And again, there's very stark differences between the AutoPrognosis features that were found to be important and the logistic regression. And so, these are the top 10. So the degenerative disc disease, isolated anterior fusion, which makes sense, fixation for spinal fracture, deformity, dialysis dependent pseudoarthrosis, bipolar disorder. And this is the second time that some sort of psychiatric problem came up in both C5 palsy and in dysphagia. And so that can kind of make sense with, some of the complications that we could get with this population. Male sex, again, anterior approach, and then posterior fusion. And it's different with the logistic regression analysis. So we were able to find that we were able to get a different list of features. And here's our top 6 in terms of age, continuous feature. Again, age is the same, but the others were very different. And so we were able to find that this novel algorithm for predicting dysphagia, we're able to find a list of variables that we can then say, all right, these are patients maybe like psychiatric patients could be at risk for dysphagia. So, if they have a history of bipolar disorder or psychiatric meds, maybe, think twice about, doing some sort of preoperative exercises, intraoperative steroid use, lower profiles, plates, things like that, things to try to reduce our chances of having dysphagia. All right, thank you very much.